with that. Yes or no, will you continue to defend Medicare drug pricing negotiation programs in court?
It's the law. I'm going to defend it and use it.
Yes or no, will you commit to the process of negotiating prescription drug prices in Medicare?
I'm going to look, as the president has instructed me to already, for every single way that we can reduce drug prices. And there are lots of options available. I feel compelled to pursue every one of them.
I'll ask you one more time, because I think I heard it, but I'll give you another chance. Yes or no, will you commit to the process of negotiating prescription drug prices in Medicare?
Senator, it's one of many approaches I want to use.
I appreciate it. I thought you might say yes a second time, but it's not yes or no. So from you, that's fine. Yes or no, do you believe that healthcare decisions, well, I already asked that one, Dr. Oz. Look, as we get through all of this, I have a series of questions that I have put together, not coming into this committee for, based on Senator Hassan's questions. I'll submit them into the record. I have a lot of concerns in these spaces. I won't get to it now. I appreciated having a conversation with you. I'm very concerned of this back and forth of my colleagues saying that they're going to not cut Medicaid or cut it, when Republicans are voting for it. Those are the realities. And as I shared with you, Dr. Oz, one thing that I've learned about Washington, D.C., the way that this place works better is when people keep their word, when people are honest. The American people want honesty. If it's bad news, they'll take it. And they're going to be stronger on how they're going to respond to it. But when they get lied to, and they think something's coming, or they're going to be protected, or a mom with a kid with cancer thinks they're going to have care, and then it gets taken away like that, then what? Just own up. If that's what you want to do, own up to it and admit it. But stop lying to the American people is what I keep saying to all my colleagues, anyone that will listen. God bless you and your family. I appreciate you being here today.
Thank you, sir.
Senator Warnock.
Thank you, Brother Chairman. Dr. Oz, welcome to you and your family. Congratulations on your nomination. I enjoyed our conversation the other day and finding out the friends that we have in common. My home state, Dr. Oz, the state of Georgia, is not only one of just 10 states in the country that still has not expanded Medicaid. It also has the dubious distinction of being the only state in the country where the limited number of families who do qualify for Medicaid are required to regularly complete bureaucratic paperwork to prove that they're still working the minimum number of hours to get health care. State officials call it Georgia Pathways to Coverage. I call it Georgia Pathways to Nowhere. The program is allowed under the state's Medicaid waiver, which is up for renewal this year. And if confirmed as head of CMS, you would be responsible for approving or denying the state's application to renew this onerous paperwork requirement. Dr. Oz, I'm not going to ask you to prejudge the state's renewal application. That wouldn't be fair. You need to see it. But since you would oversee Medicaid if confirmed, yes or no, do you believe that families should have to complete government paperwork every single month to prove that they're working just to get health care when they're sick?
Senator, I appreciate your question. I enjoyed visiting with you. My wife went to Union Theological for a while, different time than you. I brought her as a support staff.
Good.
To make sure.
That gives me comfort. Yes or no?
The answer to me is I am in favor of work requirements, and I don't believe we should allow.
Do you think a family should have to fill out paperwork every month just to get health care?
I don't think you need to use paperwork to prove a work requirement, and I don't think that should be used as an obstacle, a disingenuous effort to block people from getting on Medicaid. However, I believe we would both probably agree that there's value in work, and it doesn't have to be going to a job. It could be getting an education. It should be showing that you want to contribute to society. Frankly, you could volunteer at Ebenezer Baptist Church, where I did a show with you once. That would, for me, fulfill the requirement.
You'll never get any pushback from me about the value of a work ethic and the purpose that work provides, which is why I think people ought to have health care so they can get back to work. Very often they can't get back to work in Georgia because they can't get the health care. Let me give you an example. There is a woman in Dalton, Georgia that I got to know a while ago. Her name is Heather Payne. She's a traveling nurse. And, you know, as a traveling nurse, some jobs were better than others. Sometimes she had health care, sometimes she didn't. She was among those folks who were in the gap. She couldn't afford private insurance. But she wasn't poor enough to get conventional Medicaid. So her health challenges and the unpredictable nature of her work as a traveling nurse made it impossible for her to meet Georgia's onerous work verification requirements to get Medicaid. She found out she had had a series of strokes. She had to save the money to see a neurologist, and then she found out she'd had a series of strokes. Took a long time to be able to afford to go, and now she's in the gap, and she can't meet Georgia's onerous work requirements. Do you think Heather Payne, a traveling nurse who spent her career providing health care to others, do you think she deserves Medicaid or not?
Yes.
Thank you. I agree with you, and since we agree, I think that the Medicaid waiver that you will be responsible for reviewing, I think that Medicaid waiver, in fact, I know it, it says that Heather does not deserve Medicaid. Let me tell you about another Georgian. Amanda left her 2 jobs in New York and moved to Warner Robins, Georgia, to become a full-time caregiver for her 84-year-old father, Thomas. Taking care of her father has become a full-time responsibility for Amanda. He's 84 years old. She's taking care of him, which means he's not in a nursing home, by the way. She's taken on that responsibility. But with all of this, she doesn't have time to hold a full-time job that meets the state's strict work requirements, and she has no income to cover her own health care costs should she get sick. Dr. Oz, do you think Amanda deserves Medicaid?
From what you're describing, yes. These are the opportunities we have to make the system better. If we both agree that people should be trying to get off Medicaid if they can, we should be able to create a system where we can track that, because there's the twin paradox, which I think we touched on in the office. 2 brothers are at home. One's working every day, flipping burgers, making minimum wage. Maybe he's cobbling together $16,000, $17,000, puts him right above the poverty level. And the other brother doesn't bother working because he'll have the exact same coverage if he doesn't work. We want to make both of them want to move up the ladder. Like every small businessman, what's their goal? To become a big businessman. So
look, you and I have the basis, I hope, for a meaningful conversation. Georgia's pathways to coverage is a roadblock to care. They've literally gotten, I don't know, 6,000 people, I think, the last time I checked. And we got over 500,000 people in the gap. So I'm going to give you a softball. If you're confirmed, will you work with me and will you keep Amanda and Heather in mind as you consider whether or not to renew Georgia's waiver, which I think is filled with unnecessary and onerous work requirements, paperwork, filling out paperwork every single month. Will you keep these 2 people in mind? That's the question.
Heather and Amanda should be in all of our minds, and many others like them. I look forward to working with you. Maybe if you'll invite me down on a Sunday, I'll come to church with you.
Thank you very much. You're invited any Sunday.
All right.
You can't preach, but you can come.
Senator Welch.
Thank you very much, Mr. Chairman. Welcome, Dr. Oz, and welcome to your family. The big concern I have about our healthcare system is it costs too much. It's a real disgrace that we spend the most and get the least. I mean, so many other countries, with all the problems they may have with their healthcare system, citizens are not anxious about whether they can afford the care that they need. Here, that's not the case. And one of the big problems is that private equity, pharmaceutical pricing power, device manufacturer pricing power, consolidation in the industry, all of this has made the cost of health care brutal. It's brutal on taxpayers. It's brutal on employers. In Vermont, we have a lot of small employers. They're paying sometimes $40,000 for a family plan for their employees. They can't afford that. And it's brutal, obviously, on individuals. So I believe a major responsibility that you would have in your job would be to fight the excessive charging. I'll ask you a little bit about pharmaceuticals, but you said you're going to pursue that. You know, in his first term, President Trump said he favored a reference price for drugs. So, you know, we're paying 3, 4, 5 times for the same drug that they buy in Canada or in Europe. Would you support reference pricing so that we don't get ripped off compared to everybody else, even though we do the research?
Senator Welch, thank you very much for taking time to meet with me before this event and for that question. President Trump has been very clear that he wants me to reduce drug prices, not just that the government pays, but also for beneficiaries. International reference pricing is a way of doing that.
All right, here's what I think we all need. We have got to get a fair price, and it's not a fair price when we're paying 6 or 7 times what they're paying for the same thing in France or in Canada or wherever else. Okay, so I'm just going to stop here, but say that is absolutely top of mind. President Trump has indicated a concern about this, and I hope you follow through. Second, Medicare Advantage, it sounds good, but it's an incredible ripoff in some cases. The Wall Street Journal did a expose, incredible investigation about what United Healthcare did. And what it found is that they packed diagnoses. It was to their advantage to have a person seeking Medicare Advantage to have numerous diagnoses that really didn't necessarily require treatment. They provided doctors and nurses with checklists of possible diagnoses their patients, and they paid them bonuses for completing these checklists. So they'd pay a doctor or a nurse more if, when they examined me, they found more things wrong with me. And this resulted in about $84 billion excessive overpayment in Medicare Advantage plans. These practices, it's going to be your job to crack down on that. Are you going to have any tolerance for that kind of ripoff from our insurance companies?
No, I think you've identified a place where a system which was, in theory, a good one. Medicare Advantage is a community health focused effort.
I understand that. I just want to stay, I don't mean to interrupt, but I just want to stay on this. We cannot afford to have the healthcare system be taken over for private profit when it doesn't provide good service at an affordable price for our citizens. You agree with that?
I agree, and I think the upcoding in Medicare Advantage programs has become the best example of this out there, and it's something that is addressable, and I pledge if confirmed, now we'll go after it.
All right. You're a very nice person. I don't want you to be nice when it comes to dealing with this stuff. All right? So put that nice guy stuff behind you. That's Oprah.
I'll be surgical.
We need a fighter. No, I'm serious about this.
I am too.
We just can't afford this. You know, another thing that's happening in healthcare is private equity. One of the things that you said is that physicians should be free from corporate ownership. I'm sure you say that as a physician deep in your soul because you know it's about you helping a patient. And now private equity is owning a significant percentage of doctor practices, and private equity has made 352 acquisitions in 2010. In 2020, 10 years later, it's 937. And what they do is they downsize, squeeze, and put the total emphasis on profit instead of patient care. Is that private equity invasion of the healthcare space of concern to you for patient well-being and cost?
The one point I'd like to make is, as you point out, doctors who used to be generally completely free of corporate ownership, over the last decade, the doctors that are free practicing has gone from 70% to 30%. So now most doctors are owned by a large insurance company, a hospital system, private equity. We have to have a mechanism to disrupt the incumbents. The only way to go after the big guys is to have smaller people who are willing to put money into initiatives that could conflict with or go after their business models. Private equity is one of the ways you can do that. Yes, it can be misused. Absolutely agree with the point that it's been abused, but this is an opportunity too.
All right, thank you. Here's my hope, because we can't measure this now, but we've got a starting point. And my expectation is you'd be able to come in 6 months, let's say, and report on whether there's progress on all these things. Squeezing out the ripoff in private equity, squeezing out the ripoff in Medicare Advantage, and having lower drug prices. So I yield back, Mr. Chairman, and I thank you for the little extra time.
Thank you, Senator.
Thank you, Senator Young. Dr. Oz, great having you here. I enjoyed our office meeting. And one of the things that I find so refreshing about your nomination and the general approach to healthcare that I think the administration is taking, the Make America Healthy Again, is looking at the big picture before you dive into the details. And one point of emphasis of yours, and I know of others in the administration, is making sure that we get a hold of chronic disease more effectively. We have Americans that just for too long have not been getting the right care at the right time, and it makes our country unhealthy. And importantly, it also makes our healthcare a heck of a lot more expensive in the end. So if we just do things more smartly, as opposed to the way it's always been done because there are entrenched interests, we can make people healthier, and we can spend less money on the things that could be done a lot more efficiently. So I'm just going to ask you about prevention and chronic disease and what reforms, if confirmed, that you think we should make to existing federal programs that you'll have oversight over to include a stronger emphasis on prevention and early intervention for chronic diseases.
Senator Young, thank you for hosting me in your office. I went back and watched Hoosiers, by the way. And I would love to take you up on the offer to sneak into the Senate gym when the time comes, if I'm confirmed. The question you ask is fundamentally important to how we can make the money we're spending on healthcare work in America. I don't think spending twice as much as every other country is enough if we're more than twice as sick as every other country. And so the real question is, what's our obligation, each and every one of us? I think it is our patriotic duty to be healthy. First of all, it feels a heck of a lot better. It's the right thing for your family. You want to walk your daughters down the aisle. You want to do the things that age allows you, including being a wise arbiter of what's happening in society. But it also costs a lot of money to take care of sick people who are sick because of lifestyle choices. It's different if you're born with a defect that requires an operation. Often those are fixable issues.
Yeah,
but
people don't want to be liabilities, to your point. People want to be assets, and they want to realize their full human potential.
And if 3/4 of them can't serve in the military when they're young, how many are going to be vital when they're older? I think this sort of culminates in the bigger messages. What do you have in your fingertips that you could do? One thing that CMS can do is incentivize wiser moves. As an example, in Medicare Advantage, most beneficiaries have some type of a food allowance. But there's no real advice on how to use that money wisely, and we don't work with the private sector, maybe supermarkets, to provide better food support with that money if that's what the beneficiary decides. We don't have to order people to eat healthy. We have to make it easier for them to be healthy. Even exercising a few minutes a day will have a massive impact. There are people in the audience behind me who've done some of the pioneering work showing lifestyle reverses things like heart disease.
Yes.
The fact that medications are at times useful, but sometimes not, for problems like heart disease and even Alzheimer's, where there was a large study recently showing that you could arrest the progression of disease. This is wonderful.
Doctor, I'll be chairing the Health Subcommittee on this committee, the Senate Finance Committee, over the next couple of years. So I look forward to working with you on some of those priorities so that we can make people healthier again, certainly creating an atmosphere in which people can make themselves healthier. I don't have a lot of time here, so I'm going to run through some things. Innovation in healthcare strikes me as one of the most obvious ways for us to bend the proverbial cost curve down and help make people healthier. One of the things that I've emphasized is the importance of getting faster coverage through the FDA for emerging technologies. I had some legislation on this over the last couple of years here in Congress. Will you commit to working with me on this issue should you be confirmed?
Senator Young, yes. Indiana is a hotbed for devices, and I feel strongly about making sure Americans get the best care.
Next quick thing, artificial intelligence. Can you give me 20 seconds, if confirmed, how are you going to ensure that CMS's policies and programs foster an environment that encourages adoption and full utilization of this amazing potential technologies coming online?
Senator Young, the folks who are desirous of bringing AI into the mainstream of public health in this country need CMS as a partner. We have to make it easy to get the high quality data in a protected fashion if beneficiaries desire it. If we provide it, they will build it.
Last thing, thank you. I have emphasized in recent years that every committee of Congress ought to be a national security committee. Believe it or not, the healthcare portfolio is now a national security portfolio. We have China stealing our intellectual property and leveraging health technologies for their war fighters. And so I would just encourage you, because I believe you're going to be confirmed. I think we'll have an opportunity to work together to also periodically reflect on the important national security implications of your post. And I thank you very much and your family for your desire to serve in this capacity.
Thank you, sir.
Thank you, Senator Cornyn.
Dr. Oz, I don't believe in accidents. And I think maybe it was, we were all very fortunate that you're not sitting on this side of the dais, but you're sitting on that side of the dais, because I think what you will be able to do in your new capacity will outstrip anything you might be able to do as a legislator. And I'm excited about your nomination and the opportunities that will provide. The General Government Accountability Office, well, let me premise this. You said that there were people, and I'm interested in knowing their names, 150 people who don't want anything to change in terms of our healthcare system. I'll ask you a written question so you can provide us those names. I'd like to know who they are. But I will tell you there are people in Congress that don't want anything to change when it comes to our healthcare delivery system. That includes presumably $521 billion in fraudulent payments included for our entitlement programs, including Medicare and Medicaid, $2.7 trillion in improper payments over the last 2 decades. I presume when they criticize some of the suggestions for reform, that means they don't want that to change either, and it must change. We are at $36 trillion in debt. We're paying more money on interest on the national debt than we are on defense. That's unsustainable and in a very, very dangerous world. I know you will agree. So let me talk to you about something that I think you're uniquely qualified to address, and that is preventative care and keeping people healthy. Part of the problem is, you know, we talk a good game when it comes to health care, but then Congress has policies, particularly in our farm bill, with the food stamps, the SNAP programs, where we subsidize people eating and drinking exactly the wrong kinds of foods in order for them to stay healthy. And then we come up with a shot, which will presumably help you lose weight, and we say, well, maybe we ought to subsidize that too. It just strikes me as crazy. So what can we do to incentivize the healthcare community? Because right now we don't do it. We pay doctors and hospitals to treat people when they're sick, if it's coded by HHS or CMS. What can we do to incentivize the healthcare community to help people stay healthy longer and avoid chronic disease and the pain and misery and expense that go along with that?
Senator Cornyn, I appreciate all the help you've given me throughout my career and your kind words. When I called a good friend after the nomination who'd been involved in the campaign, he said, it's just like we planned it out. It is remarkable that although we all agree that value-based plans and programs should be the foundational way that we incentivize doctors, nurses, and others, hospital systems to deliver care, we make it difficult to use those plans. We use third parties as intermediaries who often charge so much that they take away the benefit of the value-based program to begin with. But at its very core, physicians need support. Everyone providing care needs support to be able to do what you just said. Giving patients advice on lifestyle takes a lot longer than telling them to take a pill. Doing surgery on people pays so much more than giving them advice about how to avoid operations that it's difficult to imagine anyone not doing the wrong thing in that model. I remember early in my career, I was asked to help develop the advertising plan for New York Presbyterian Hospital I was practicing, and they wanted to talk about new technologies and this and that. I said, that's not the question patients ask. Patients want to know, when you offer them heart operations, do I really need it or not? That's the first question. And we don't reimburse that question's answer, which is what we should be doing. I believe, and we've been asking questions back and forth about AI, that we can use technology, information technology, artificial intelligence in particular, to provide more of that infrastructure support so that when the physician talks to you, the main thing they say is, I endorse what you just heard about a lifestyle change for you in particular based on your background, any history we have on you, and all the other places that the healthcare system has touched you. For much of this to happen, we have to know who you are. So one idea that I think will come up eventually is this concept of how we can tell which patients have been in which centers, all that interoperability of information and transparency safely shared with you, the patient, I think will arm you with a bit more motivation to take charge. And for people who are recalcitrant, as Senator Wyden has been talking about for more than a decade, I do think reward systems could be beneficial.
Well, there's so much more I want to talk to you about, and we'll do that after you get confirmed. But let me just say that if modern medical science can devise a shot or a pill which will give me the self-discipline to exercise on a regular basis and to eat a healthy diet, I want to be first in line for that shot. Unfortunately, I don't think that shot or that pill exists. So we need you to use the bully pulpit because you're a great communicator. I believe you can be a tremendous asset to communicating to the American people the importance of doing some of the things that will make their life happier and healthier. Thank you.
God bless you, sir.
Senator Scott.
Thank you. Dr. Oz, thanks for being here. Good to see you again. Certainly I'm excited about your process here. And I'll go along with John Cornyn there. If there is such a shot that makes you want to exercise more, I may have to wait until its generic brand comes out to be able to afford such a shot, because that should be really, really expensive for a short period of time. But to that point, I'm not going to ask you to comment on it, but my theory is that we need to have a long conversation about how expensive drugs are these days. But at the same time, we should have a similar conversation about how when drugs hit the generic market, they drop precipitously in price, and it's that way forever. So I would hate to, for the lack of a better way of saying it, shortchange the American people by focusing on the original sticker price without having the value proposition long-term over the ultimate cost of a drug when it's in the generic forms. I do think we're not really having a serious conversation with the American people about the fact that 94% of the morbidities that we face every day are on a generic medicine, and that because of that, you can go to Walmart or Publix or wherever you go and get a 30-day regimen for $4 or $10. And that value proposition that we bring to the American people because of patent protection is really important, though we very rarely focus on the back end that lasts for a lifetime and the front end that lasts for 5 to 12 years. And probably need to figure that out. But ultimately, protecting that patent protection is really important from my perspective. Not necessarily need to hear your thoughts on it yet, but I am hoping that you will commit to coming to South Carolina, having a conversation with my folks in South Carolina about the job that you are going to have. Is that a commitment you'll make?
A commitment. My roommate from college is from Greenville, South Carolina, so it's a good excuse to see him too.
Well, I hope he's not a Tiger. Anyways.
He's a Tiger.
As a Gamecock fan, I knew he was. There's something about that thin air in Greenville that causes people to be a Clemson fan. For those of us listening to us, it is just a joke. I just lost several votes there, by the way, so I'll move on. I want to say thank you for the compassion that was woven into your opening statement. We are both men of faith, and I think those of us from a faith background share the philosophy that we find embedded, at least in the Bible, in Matthew 25, that we have a responsibility to help those in certain categories, whether it's the widow or those folks suffering and going through challenges. I think it's really important for us as a nation to embed that ethos in our approach to solving problems as a nation, especially for the most vulnerable. And your opening statements reflected that kind of compassion that I think we desperately need to see more of on our national screens around the country. To that end, the sickle cell anemia challenge that you talked about when you met with our staffs, thank you for bringing it up without having to be prompted to it. I do think that CRISPR technology as we know it today is going to transform medicine as we know it tomorrow. I'd love your thoughts on that, and I hope that you have a commitment in your new position to move forward with some of the cell and gene therapy access models that we're talking about, making it affordable for people stuck in Medicaid or Medicare, or not stuck, but on Medicaid or Medicare.
Well, Senator Scott, thank you for bringing sickle cell anemia and similar CRISPR solutions into the forefront. There's a lot that we have benefited from that is only there because we've incentivized innovation. And so sickle cell anemia, a disease which I've taken care of patients with because they often develop problems with organs that require surgery, is a crippling problem that causes a lot of pain, and then you die, but you spend a lot of money on the way. And there's a treatment, let's just say it costs $1 million. It's roughly the number that I'm hearing, that if we could offer these young children, often of African-American descent, this treatment, then they would be cured. So I think there are ways for us to amortize that cost to save the child's life and reap the benefits of them not being in the hospital, running up big bills while they die in pain. That seems to me a pretty good investment. We just have to get our minds around the idea of paying $1 million to save someone's life and demonstrating that if it works, that the drug company should get paid over a period of time to make up for the fact they made a massive investment to build that solution. Those are the kinds of innovations that I think we could bring to bear, where you could actually imagine medications only being reimbursed if they provide a benefit that we all agree is true over time. And just to the earlier comment, because you brought up faith in the broader issues, the oldest hospital that I'm aware of that still exists is in Cairo. And this hospital historically would take patients in. You wouldn't pay for care because you're sick, you don't have money. When you left the hospital, they would give you money. It's the opposite. Why? Because when are you going to have the least amount of money? When you're sick and you're getting better. So they would actually give you something to get going again. I think those are the kinds, at least metaphorically, ideas we want to support, to get people back on their feet again and then make them feel obliged, responsible, because it is a shared responsibility to our health system, to do what they can to stay healthy so the system works for everybody.
I know that I'm out of time, but I'll ask my last question and ask for a yes or no answer, if that's okay with you, Chairman.
Yes, go ahead.
Thank you, sir. During one of the silver linings, if there was a silver lining during COVID, and it's really hard to think of that catastrophic occurrence having any silver linings, if there was a silver lining in COVID, it was the development and the acceleration of telemedicine. And I think it's going to save millions, if not trillions of dollars over time. I hope that you are committed to doing as much investigation as necessary to make sure that telemedicine is not just here to stay, but that it is embraced and adopted throughout our country wherever it is practical to be used.
I pledge that if confirmed, I'm going to pursue telemedicine. I think it's essential, especially in our rural areas.
Thank you, sir.
Thank you. Dr. Oz, we're almost there. Senator Wyden has one more question for you, and then he'll give a brief wrap-up statement, and then I will give a wrap-up statement, and we'll be able to.
Thank you, Mr. Chairman. Dr. Oz, I wanted to ask a question about something that has really been part of your wheelhouse, as far as I can tell, for decades, and that's the insurance sector, and particularly marketing abuses. And I go way back to the days, when insurance salespeople would sell 5 or 6 policies to a senior citizen. Traditional Medicare stuff wasn't worth the paper it was written on, and I came to Congress, and Bob Dole, I didn't think he even knew my name, we got it fixed. But the abuses continue. Yeah. And I'd be interested in your thoughts about what you think the biggest abuses are now, and then I'm going to ask you, I'm going to make this half of my question, a quick response in terms of what you're going to be dealing with if confirmed. What do you think the biggest abuses are right now in the private insurance sector?
Medicare Advantage sales.
Such as? Well, I mean, give me an example of
There's
something.
brokers that get involved in churning policies. So they get you to switch from policy to policy. We should potentially consider whether you need to re-elect Medicare Advantage every year and potentially offer multi-year programs for seniors, because that would save some of the money that the brokers are taking out of the middle. Some brokers do a great job, some don't. We probably have too many. I think there are ways for us to ensure that marketing process works better for the folks involved. But it's also what the Medicare Advantage plans also do with the monies that they use to incentivize the American people, the 33 million people on Medicare Advantage to come into their programs. And we should examine whether some of that money should be reimbursed to the American people to ensure that Medicare Advantage does not cost more than fee-for-service Medicare.
I'll have some additional questions for the record on this, but let me leave you with a thought. We finally got some rules that have been put in place really in the last few years. There's probably going to be a big effort because the Trump administration has been talking about rolling back a lot of the health standards. I want to get a sense before we vote on which ones that you would be sympathetic to if anybody tries to do that, because I think that is a sure bet in terms of what's coming, that there will be some sleazy operators. We both know that there's some good people out there, but there's some sleazy operators, and I think they're going to push for a rollback in some of the rules that have been adopted recently, and I'll want your assessment of that. Thank you, Mr. Chairman.
All right. Thank you, Senator Wyden. And Dr. Oz, thank you again for appearing before us today. There is no doubt that you are qualified to serve as the next administrator of the Centers for Medicare and Medicaid Services. And I look forward to voting in favor of your nomination and am urging all of my colleagues to do the same. With that, I remind my colleagues that the deadline for submitting any questions for the record, and you will get some more questions to answer, is 5 p.m. on Wednesday, March 19th. So for my colleagues, the deadline is 5 p.m. on Wednesday. The Finance Committee stands adjourned.
Thank you.